So let's just consider quickly what the courses are about and some theory. And I'm going to show just 2 slides, which will explain the approach that we're going to take in helping improve quality and safety in this new era. The first is basic quality management, and I just go back always to Duran, who really says that to manage quality, you just have to have the trilogy. So a lot of it is about planning. How do we plan going forward? And really for me, is how do we plan our healthcare systems in the next era post-COVID? One of the things I really do not want to happen is for us just simply to revert to what we had before. And I think that is going to be one of the big challenges of us all in healthcare, is how can we plan for quality as we build our new systems going forward in the future. The next one will be on quality control and measurements. How do we really set evaluation of our services, of what we do, in a way that is person-centered? And that is person-centered for the staff, the people who provide the care, and for those who receive the care. And how do we provide quality improvements? And we'll talk about that in this section. Now, in quality planning, I think that where we need to go forward now is really embrace the concept of co-production and thinking about how we've moved from the different stages of quality, of firstly just having standards and then developing the more technical approaches of quality improvements, and then moving to the quality standards. So how can we get to quality improvement going forward and go into that? And then the basic improvement methodology that the whole courses and everything that we do on is based on Deming, which is really understanding how our system works, the processes and variation in the process, and what people believe and how we can make changes. And this on one slide gives you the foundation of the quality improvement programs that we plan to have. I'll just go on to this. So just to go back to this one, when I'm speaking to people who were working in hospitals, and I was speaking in Ireland, I run a number of projects, and I was speaking to them recently. And one of the projects we had was on situation awareness and how we could bring safety for people, children who were deteriorating. And all they needed to do was adapt it from face-to-face to virtual, the way they were spreading information. And they just looked at that and they used these simple principles again, studying how their system process worked, where they needed to look at the variation and how they could continue to improve. And it was amazing how they said they applied this theory in practice, and that really worked.